Hi everyone, my name is Katerina Behrens, and this is my presentation about my internship at Texas Physical Therapy Specialist in San Antonio, Texas. Texas Physical Therapy Specialist is located in Stone Oak, San Antonio, Texas. It is an outpatient clinic and one of their biggest clinics for their company. They have a variety of different ages of people that they see and different conditions that people come to get treatment for. Services include post-surgical rehab, injury prevention, and performance training. The team includes PTs, PTAs, and PT techs. So I was under the supervision of Dr. Kellen Berry, who is a PT. He is, I think, 1 year into being a PT after graduating from graduate school, and his mentorship and advice really went a long way in this internship. Some objectives that I took away from this internship would be to apply what I learned in the classroom to real life patients. So understanding the anatomy, understanding the equipment they were using and the exercises, while also gathering how they are feeling and how it responds to the treatments. So how, if they are feeling unwell, okay, then we should stop the treatment, and learning that in class was beneficial to real life patients. And then developing hands-on skills for patient care. Hands-on skills has been the most beneficial thing for my education and to further my education to solidify what I've actually learned. Communication is huge when communicating with patients and with the team. And then gain experience with clinic flow and equipment. The clinic flow was a little bit hard at first to grasp, but it was very easy over time to understand the flow, even from the front office, understand how they do things and being able to help with that. And the equipment, I had to learn the equipment and do some research on them for their database, while also telling a patient, hey, this is the equipment, this is how you use it, and this is how you adjust it. So understanding all the equipment was great. That would help benefit me in the long run. I had many great experiences working at this clinic. The best experience, I would say, would be talking with clients. Some clients really love to talk instead of doing their exercises, but I found it that for those who struggled with their motivation, to talk to them while they're doing it, while also keeping key points and motivation of you're almost done, you have this amount of time left, like trying to get them to work while talking. And it was great to see the improvements of clients that I saw from the first day who had little to no mobility and then slowly progress, and they were able to graduate from their treatment. So learning consistency and staying with it was a great experience to see firsthand, while also practicing the encouragement, that giving encouragement goes a long way. I would say the most difficult experience for me would be to handle the different personalities in terms of patients and their pain levels and their motivation to the sessions. So for example, would be a patient coming in after surgery, it's maybe their first session, and they're having hesitancy to put weight on something, or something really hurts. It can definitely have an effect on how their treatment goes. And so when you're dealing with someone who maybe doesn't want to do the treatment or doesn't finish an exercise when maybe they can, unless they communicate to us that they can't, that's one thing. But when you're dealing with people who maybe don't want to be there, it's hard to motivate them because they're not motivated themselves. So it's hard to kind of a little bit read the room or how the person is doing. So that was challenging for me to handle a little bit, but I got a grip on it. It's just more of communication is the big thing that you need when you are dealing with that. Some things I would do differently is ask more questions early on. Even when I thought I asked more questions, there's always more questions that you could be asked, and being comfortable. Also, I would take more initiative with setting up treatments, like the evaluation rooms. I was always kind of nervous to set them up because I didn't want to do anything wrong that would hinder the evaluation for the PT. And then documenting learning movements daily. So I would work on the documentation, as all PTs have different ways that they do things, and so it's just about learning how each PT does certain exercises, or on the document itself, like understanding their language, because every PT is different. So I think that for me in the long run, being a tech, it would just be more confident in what I'm doing while asking questions about it. And I would also like to explore not just one PT, but other PTs, and get kind of shadowing under their wing as well. The most important professional lesson that I've learned is communication is key, and that progress, no matter how big or how small, is still progress, and that working as a team definitely improves outcomes, and especially for treatment areas, especially for how big this treatment facility was, everybody had to work as a team. So I wasn't just under one PT doing things only for him, like I was doing things for other PTs, being aware of their patient is on the Alter G, no one else is able to get them off, okay, I can help get them off and ask what their next exercise is. So it's just being aware and being a team player that is really going to help with this movement of the day and the flow, and that everything goes as smoothly as possible.